As we have many times in this broadcast, we're taking a look today at the bigger picture of the pandemic here at home. This week, the number of Americans who have lost their lives so far has surpassed 150,000 people, and the rate of infection continues to spike in many states, 21 of which the federal government has labeled red zones. This, as a new report by scholars at Johns Hopkins University warns us that, quote, unlike many countries in the world, the United States is not currently on course to get control of this epidemic. It is time to reset. The Association of American Medical Colleges warns, quote, if the nation does not change its course, and soon, deaths in the U.S. could well be in the multiples of hundreds of thousands. Back with us today for the big picture, Pulitzer Prize-winning science journalist, Foreign Policy magazine columnist, and MSNBC science contributor Laurie Garrett. She warned of an upcoming pandemic like this one in her 1994 book, The Coming Plague, Newly Emerging Diseases in a World Out of Balance. Laurie, I wonder every day about this time if we're asking the wrong questions. It would seem that the whole debate about how to go back to school maybe should have been replaced by a debate about whether to shut this country down again as we did in April. Your thoughts?
Well, Nicole, the problem with the shut down the country proposal, which in general I agree with, is that shut it down with what strategy to replace it, what government to execute said strategy. And very clearly, the Trump administration is not interested at this time in executing a strategy that would perhaps bring most of our economy to a standstill for a substantial amount of time in the lead up to the election. So sadly, I think there's a decision already made in Washington to utterly ignore this call, a very correct call. We've made so many mistakes, it's phenomenal. The list would take all day to delineate. But, you know, the bottom line is we need a coherent national strategy. We have never had a coherent national strategy. We've simply farmed it off to the states, and many of the states have farmed it off to their counties and cities, so that no two places are doing precisely the same thing. No two places are giving the same guidances to schools about how to reopen, to restaurants about how to reopen or whether or not to reopen. So we're just in a state of complete chaos. We're losing this fight, and we don't even really know what the data is. We're saying it's 152,000 have died so far, but the truth is that the data is now going through a series of channels that end up at a company called Palantir that's run by Peter Thiel, and who is a close ally of President Trump. And the goal is to try and downplay the severity of our national outbreak.
Take the data that we have, 152,000 Americans and 152,000 worlds blown up, destroyed forever without their child or their husband or their wife or their sister or their brother. If 152,000 Americans had died in 5 months out of terrorism or gang violence or some other mystery disease, we would have a very different public policy approach. I mean, why do you think our policymakers, at least the ones in the White House, are immune to the death?
Well, Nicole, I can't begin to imagine what's going on inside the heads of people that are making these decisions in Washington, and I'm not going to presume to know what they think about 152,000 deaths. What I can say is this: every American should be not only grieving all of these losses, but ashamed, outraged. How could it be the great capital of science on planet Earth, with the most innovations, the most breakthrough science of any nation in the history of the planet, could have botched this so phenomenally, doing a response? The only places worse are places like Brazil. I mean, we've made every mistake in the book. And at this point, I have said before, and I'll say it again, I think we're going to get to Labor Day with our death toll at 200,000, perhaps more. And then sometime in September, we're going to be looking at 250,000 dead Americans. And the pace of this could get completely out of control if we don't figure out how to clamp down. And I just think it's incredibly naive to imagine that states that don't have very deep benches in their public health departments, that have faced layoffs and cutbacks in public health for the last decade and a half, 2 decades, are going to suddenly be able to conjure some strategic plan for dealing with the virus that's going to be better than what everybody's already been trying. We need a national level initiative, and it needs to be based on real science, not on hydroxychloroquine or don't wear a mask when you're with your staff, but wear one maybe when you're on camera. This is just so aggravating, so annoying, so maddening. I understand why medical institutions all across America are sounding the alarm. This isn't a partisan question. This isn't a matter of, did you wake up this morning a declared Republican or a declared Democrat? This is about saving American lives and stopping a pandemic that is destroying our economy, that is destroying human lives, and disrupting all medical care for all diseases, all ailments, so that regardless of whether you get COVID, your diabetes may be going undertreated, your heart disease may go undertreated. Our whole country is disrupted by this at every single level. And to imagine that we're going to go yet another day, Nicole, or another week, or another month with this chaos is to, just be beside ourselves with, indignation. How could this be?
How could this be is a question, Laurie Garrett, I'm going to keep asking you every time you come on, because I think that we try to look at all of this loss of life as each life blew up the world of everyone who loved that person, and for so many worlds to be blown up, and it didn't have to be this way. How could that be? Laurie Garrett, we are so grateful to get to talk to you about these things. To be continued. Thank you. We're also continuing our coverage of the final farewell for Congressman John Lewis as he's laid to rest in Atlanta.